If you need dental implants, call us. We'll do a free exam and x-rays, and we'll do a 3D image, and that'll tell us what exactly you need and if it's possible. As you come in, we can explain the options, explain the best options for you, and figure out if you are a good candidate for dental implants. We do everything here. We do the surgery for the dental implants, we do the bone grafting here, and we place the implants, we restore the implants all in one place. Just like everybody is not the same candidate for dental implants, everybody needs options. Everybody doesn't have the same budget, everybody doesn't have the same problems in their mouth. So we give you a variety of options, show you what the best options are, and let you decide. A well-placed implant can last a long time as long as you take care of it and your health is good and there are no issues going on with it. There's 3 parts of the dental implant. There's the dental implant itself, and that goes into the bone. There's the abutment, which basically is the part that attaches the crown to the dental implant. Depending on how well that integrates into the bone, teeth were meant to be lined up like soldiers that are right by each other. They need the protection and the strength from other biting forces. So as you replace that tooth with the implant, you're replacing and restoring your whole mouth and giving it strength. The best way for you to find out if you're a good candidate for implants is to come in, let us take some x-rays, a CT scan, and find out the bone density, take a look at your gums and see how healthy they are and what we can do for you.